Thank you, Mr. Speaker. House Bill 505, an act relating to alcohol and drug counselors, talks about the importance of the peer support specialist, which we now have a certification, but it updates some of the criteria and standards around this practice. We understand how important this category of counselor are. They have lived experience. They work in many addiction treatment facilities, and in fact, addiction treatment providers claim that they could not do without them. However, there are some issues around the standards and eligibility for these individuals, and this bill simply strengthens the peer support specialist program, adding some eligibility standards and criteria. It moves peer support specialists to live under the Alcohol and Drug Counselor Board for oversight. It updates the Board of Alcohol and Drug Counselor Board members from 7 to 11. It establishes criteria for registration as a temporary alcohol and drug peer support specialist, and it outlines the requirements. It updates references to associate alcohol and drug counselors 1 and 2, and it amends the requirements for peer support specialists, as I mentioned, adding supervision or additional supervision, and it adds that individuals must attest to being in recovery for a minimum of 12 consecutive months from their substance use disorder in order to participate in this program. It allows temporary certified alcohol and drug peer support specialists to be reimbursed at the same rate as certified alcohol and drug peer support specialists, as they are providing the same services while awaiting the results of their certification. And the committee sub actually just requires that the cabinet seek federal approval through a waiver if they determine that such approval is necessary. If there are no questions, I move passage of House Bill 505 as amended by the House Committee Substitute.